Hello, everyone. My name is Gabria Monet Pearson. I graduated from Spelman College and got my master's in public health from the University of Arkansas for Medical Sciences. And I am currently an environmental health specialist with the CDC. So I know that you all have some concerns regarding the safety of vaccines for your children. So by the end of my presentation, I hope that I have addressed some of your apprehensions against them. So the objectives for this presentation are to further you all's knowledge about vaccines, go over their importance, discuss the myths and facts about them, and ultimately reinforce your decision to get your children vaccinated or inspire and educate you to now get your child vaccinated. So, what are vaccinations? According to the CDC, we define vaccinations as a preparation that is used to stimulate the body's immune response against diseases. Vaccines are usually administered through needle injections, but some can be administered by mouth or sprayed into the nose. So that can be a lot to kind of understand. So, in layman's terms, it is a substance that helps your body fight against a specific disease, and it's usually given by a shot. So, here is a timeline of some of the vaccines that have revolutionized healthcare as a whole. So, I wonder how many of you knew that vaccines were a relatively old concept. As you can see on this timeline, vaccines have been around since the 1700s. According to the Immunization Advisory Center, Edward Jenner is considered the founder of vaccines. Jenner collected cells from someone who was infected with cowpox disease and deliberately exposed an unaffected person with those cells. Later, the individual was exposed to smallpox and did not contract it. So, through this experiment, he concluded and eventually formulated a vaccine for smallpox. The vaccine was officially created in 1978, and by 1979, smallpox was eradicated across the globe. So if you look through this timeline, you will see many vaccines that you probably recognize: the the influenza vaccine, the MMR vaccine, and hopefully the COVID-19 vaccine will be added on this timeline soon. So it's great that there's a long history of vaccines, but why are they truly important? So according to the CDC, vaccinations are the act of introducing a vaccine that stimulates the body's immune response against a disease and produces a form of protection from a specific disease. After a vaccine, your body creates antibodies. Think of antibodies as a little fighter cell that remembers how to ward off the disease that it was initially exposed to. So when it's exposed to it again, it'll know exactly how to fight it off again. Vaccines are also important to get if you are eligible, because not everyone is available to receive them. So whether it be because the person's health, her age, or even allergies, they may not be able to get all vaccines. So yet if people who can get vaccinations do, herd immunity will form. And I will go into greater detail about this later in the presentation. Lastly, and most importantly, vaccines save lives. Vaccines can eradicate diseases. And like I mentioned earlier, smallpox is globally eliminated, and polio is extremely close to being destroyed as well. So there has not been a case of polio in the United States in over 30 years, but it still is affecting people in other parts of the world. So it is not considered completely eradicated. I liked this little comic panel because it shows the eradicated diseases and also the ones that are extremely close to getting there. So I know there are a lot of statements and so-called facts floating around about vaccines. So I wanted to address a few of them, and I will state the comment or claim and think to yourself if you believe this is a myth or a fact, and we'll discuss it after. So vaccines will give my child autism. I know that this is one of the most inquired statements I get all the time, and it's a myth. I cannot stress this enough. Vaccines do not cause autism, and there is no evidence linking them together. This phenomenon started in 1998 with Andrew Wakefield and 12 of his colleagues. They essentially published this article stating that MMR vaccine might cause children to get autism. And there were many flaws in this experiment. So the sample size was only 12, only had 12 participants. There were many ethical violations. There are even some claims that he was paying the participants. At the end of this, Wakefield later lost his medical license, and the article was found to be completely fraudulent. Even though it was disproven, it still caught many people's eyes. And it is now believed that autism is a disorder that individuals are born with and not anything that can be acquired, which just further disproves his point. Additionally, many parents claim that their children start showing signs of autism after vaccinations. And the reality of the statement is that there could be some truth to it. So, according to the CDC, the first signs of autism can be seen between 12 and 18 months. And by 2 years old, a formal diagnosis can be made. So, well, between 12 and 18 months, a child gets about 9 to 10 vaccinations. So, naturally, as a parent, it appears that these new vaccines that their child just got might be causing these noticeable changes in behavior, but there is no proof of that. Lastly, over the years, there has been an astronomical increase in autism diagnoses. As you can see in this graph over here, from the year 2000 to 2020, there has been a 178% increase in autism prevalence. Additionally, between the years 2000 and 2020, there has been an additional 4 new vaccines added to the group. So it is commonly speculated that the increase in prevalence is related to the new vaccines, which is believed to be false. There are various other explanations for this increase. It could be due to a better identification and screening methods for autism, a variation to the diagnostic criteria, or even an increase in awareness among schools and parents and physicians. Again, I want to stress there is no evidence linking vaccines and autism. Okay, so for our next statement, I don't have to vaccinate my child on the set schedule that my pediatrician recommends. This is a fact. So by the time a child turns 2, they should have around 25 vaccines, which I know sounds like a lot because it is. And at some visits, children can have up to 6 shots. So spreading them out is perfectly fine if they are administered in these designated windows that I'll show you in a second. So the reason behind clustering them together is to try and limit the number of times families have to come to the doctor. So when the number of doctor visits are decreased for vaccinations, the vaccination rates actually increase. So for example, think about the Johnson & Johnson COVID-19 vaccine. It was 1 shot. So when those participants or when those people got the first shot and the only shot, they were completely vaccinated. But the people who got the Moderna and Pfizer, after they got the first shot, many of them never came back and got the second shot. So their numbers don't match because people just tend to not come back for vaccines. So here is the CDC vaccination recommendation for birth to 6-year-olds. And this yellow band is that window I was talking about that parents can choose when to vaccinate their kids. And I have a QR code if you'd like to take a second and scan that handout to have for you. And here is the vaccination recommendations for 7 to 18-year-olds. And here's another QR code. You can take a second and scan. Okay, so the next statement is, if I don't vaccinate my child, it doesn't affect your child. This is a myth. So there are some vaccines that cannot be administered until the child gets a certain age. But those children are still susceptible to contracting those diseases. There are also children who cannot get vaccinated for other health-related reasons. So by not vaccinating your child places those other children at risk. So this brings me back to my earlier point about herd immunity. So according to the Mayo Clinic, herd immunity is when a large amount of the population is vaccinated or immune to a disease. Therefore, limiting the amount of community spread. Looking at this image right here as a reference, we can see that when the disease or infected child encounters a child who is vaccinated or immune, the spread of the disease stops there. On the other hand, if the disease or infected child is near a susceptible child, that vulnerable kid can then develop the disease and become another infectious carrier. Therefore, a decrease in vaccinations means no herd immunity, and no herd immunity means more infected children. Not just your child is affected by that choice. The next comment is, vaccines contain formaldehyde, mercury, and aluminum. So this one's a little tricky, but it is a fact. I know it is very shocking because it's very shocking to me, but it is true. Vaccines commonly contain formaldehyde, mercury, and aluminum. So formaldehyde is needed in vaccines to inactivate the toxins from the bacteria and viruses. So take this normal pear, for example. It contains about 12,000 micrograms, right? But your vaccine will only carry about 100 micrograms at max. So a pear contains nearly 50 times more formaldehyde than any vaccine. And the average 2-month-old has about 1.1 milligrams of formaldehyde already in their blood. So mercury, on the other hand, is needed to preserve vaccines and increase their shelf life. And there has been no proven harm so far with using this. And aluminum has been used in over 1 billion vaccines thus far. And on average, it's about 0.1 to 1.5 milligrams of aluminum per dose. And babies are exposed to aluminum in breastfeeding formula and soy formula as well. So the biggest takeaway from this is, think about what Paracelsus says. He says the dose makes the poison. When we hear those elements and compounds, our alarms immediately go off. But it's not the compound, it's the amount of the substance that causes the real damage. Here's our last statement. Children should get the COVID-19 vaccine. This, of course, is a fact in my mind. So as of Tuesday, November the 2nd, 2021, the CDC director, Dr. Rochelle Walensky, recommended children aged 5 to 11 to get the COVID-19 vaccine. So as we've witnessed the Delta variant, the COVID-19 virus can mutate and constantly affect different populations. As we know, the initial variant targeted the older population, and now this Delta variant is infecting the younger population. So, lastly, you cannot monitor your children at school. And with this Delta variant directly targeting them, you can send your kid to school and say, hey, wear your mask and make sure you social distance. But for all you know, he's wearing it as a bandana and holding hands on the way to the lunchroom. So it's recommended that you get it for your child, your household, and everyone you come in contact with. So I just want to close with this comic, and it says, Mom, remind me why we didn't get measles shots. They're bad for you. I read that somewhere on Facebook. So if you choose not to vaccinate your child, that is completely your decision, and I respect it. But now you have been presented with additional facts and possibly some knowledge for you to make an educated, not a Facebook, an educated decision on whether to vaccinate your child or not. So here are my references. And I greatly appreciate you taking the time out to listen to me today. And I hope you have a great rest of your day. Thank you.